63-year-old male. History of shortness of breath, worsening this evening. EMS arrival is tripoding. That's when like your hands in front of you and you're like leaning forward. It's a sign of respiratory distress. Oh, you're like, oh, oh. It's not bueno. It's no bueno at all. Treated on scene with like the classic treatments for opening up your lungs: oxygen, albuterol, which is a beta agonist, ipratropium. I'm not quite sure what drug that is, but it helps open up the lungs. Doesn't help. That's not good. Worsening dyspnea. He's given epinephrine. Started on a non-rebreather and transported to the nearest hospital. I guess we can do this initial stuff to see if he's actively dying. Good. Airway, breathing, circulation. Always do that on any kind of critical patient. Those are the first 3 steps, and then you can take your time doing some other stuff. Oxygen's not great. 82. Blood pressure is not great. Oh, great. This guy's sick, man. Check out his lungs. Check out his heart. Check out everything else. Abdomen. Skin. He's breathing fast. That's tachypnic. There's wheezing, so the lung vessels are all a little closed. The lung is like a big tube that goes in little bally boys called alveoli, and the alveoli can get crumpled up. The tube, the bronchus can get clogged, can get a little closed. This guy's probably a smoker. Been doing this for a while. All right, he's on this oxygen. Let's see if we can get his oxygen up without having to intubate him. That's gonna be our goal. Just breathe, dude. Just breathe. That's what we say, right? Just look at his chest x-ray. That's gonna be a big sign. Let's see what the chest x-ray shows. Ooh, that's not great. A lot of fluid around the heart. Well, not fluid around the heart, in the lungs. All this haziness. Can't even see the heart. All throughout the lungs. So he has some fluid overload. Not great. So we have to get that fluid off, but let's do some investigations before we do that. His oxygen's not great. Make sure he's not having a heart attack with an EKG. Let's ultrasound his heart and his lungs. We can see if he's super fluid overloaded, and we can see if there's any fluid around his heart specifically, because that can really constrict the heart. The heart is like a muscle in a sac. This is just fast. It's just fast. I mean, he has to breathe a lot because he's not getting oxygen to a lot of his lungs because of the fluid, the pulmonary edema. And so his blood isn't really getting oxygenated because all the pipes and all the little ball boys, the alveoli, are clogged. And that's where the air goes in and transfers the oxygen to the blood. And all that's clogged. And so the body's like, shit, where's my oxygen? So it's trying to beat the heart faster to get more blood into the lungs and then get it to the rest of the body. B-line predominance in all lung zones. B-lines are these little, I don't know why they appear, but you can see them in the lungs, and it just means there's a lot of fluid around the heart. Okay, that doesn't count. All right, I guess this guy's kind of sick. Maybe I should have gotten some, maybe we should have intubated him. No, he's flash pulmonary edema, so I'll show you how we'll save him. No, that doesn't count. That doesn't, don't add that to the unalive. That doesn't count. All right. Okay. All right, buddy. Welcome. Okay, round two. I got this. I got it. Do these exams: pulmonary, abdomen, heart, neck. We know. Let's get an IV on him. Get him to the monitor. Get him on some CPAP, so we're going to blow pressure into him. This is positive pressure, and so instead of just passively giving him oxygen, we're going to create a seal around his mouth with a pressure valve so that we're actually blowing in oxygen hard into his lungs to open up all those alveoli, all those stuck stuff. So we're not going to cheat. We're going to do our same stuff, but we're going to move a little faster this time. Yeah, no heart attack. Chest x-ray, we'll see there's a lot of pulmonary edema. Let's get him on some nitroglycerin. So nitroglycerin is usually used for heart attacks. It opens up all your vessels, like all your veins, arteries outside of your heart, And so that allows a lot of air space for fluid to go. Um, that's where it's all gonna go. So look at that. Look at that. Oxygen back up to 92%. Blood pressure's looking a lot better. He's chilling. I think he's doing great. We don't have to intubate him, which is good. Intubation is never a benign thing to do. Sticking a tube down someone's throat and breathing for them while they're knocked out. You kind of want to avoid that. Let's do another chest x-ray to see if it looks any better. I don't think it'll change that fast, but yeah. Not changing that fast, but the fluid is getting off of his heart because we've opened up all those pipes in like your arms, your legs, and that's where all the fluid's gonna go now. Other meds, his blood pressure's fine. That's high, but we don't want to lower it just because it's a big number. Heart rate's a little high. Nothing really to do about that though. We can talk with. It's not really cardiology. You wouldn't really talk with cardiology in this sense, unless it's like new onset heart failure. Let's just see. Certainly possible SOB shot that the SOB, the son of a bitch, it has a cardiac cause. Yeah, I already did all that. Thanks a lot, dude. It's kind of all you do, but he can go up to the med surge floor for a flash pulmonary edema. Fluid overload, subacute pulmonary edema, it might be cardiogenic. Sympathetic crashing, acute pulmonary edema. Fluid overload, subacute. We'll say it's that. It's like something like that. Maybe it is acute. This is probably acute, actually. Sympathetic crashing, and so we'll send him to the ICU. I think that's the eventual thing. Let's see. He's stable. Yeah. Yeah, I don't care about review of systems. That's boring shit. We got all the interventions. That's what's important. Investigations. What could we have done? Oh, we didn't get any lab work. We knew what was going on. Talk to wife. Oh. Well, I didn't know you could talk to wife. That's a win. That's not an L. That's a win. That's a win. Talk to wife? Like, what the fuck? What am I supposed to? 6 patients saved and only 2.5 killed. Unalive, sorry. Not bad. It's not bad. That's not a bad ratio, right? How's that sussy? How's that sus? That I saved 6 people. It's a lot of people. It's like a modern family. Don't worry about the number below that.